Hello, welcome to the Wellness Lab podcast, where we strive to provide valuable insights, information, educational content for you to learn and obviously improve your overall wellness. Today, we have the pleasure of having Dr. Todd Born here with us to talk about how he's revolutionizing chronic disease care and the approach of from a root cause perspective on integrative medicine. So, thanks as well for 15 Element for being our sponsor on this podcast. And before we dive into the conversation, I'll pass it over to you for a quick intro, some of the background, and if you want to dive into the personal experience you had and how it drove you into where you are today, that will be amazing. And thanks for being here, Todd.
Sure. Thanks for inviting me. Pleasure to be here. I'm Dr. Todd Born. I'm a naturopathic physician, and this is my 16th year of practice where I see a lot of everything, your routine cases, diabetes and thyroid and fatigue, but a lot of pediatrics. So I have a full family practice where I see, the newborns all the way through our centenarians. But kind of my claim to fame, so to speak, it's not really self-acclaimed. It's just why people get referred to me from all over the United States, because my practice is 100% telehealth now and has been since even before COVID. 2019 is when I shifted to all telehealth. So 70% of my practice is the United States and 30% is international. And most people get referred to me by a friend or a family and a lot of other doctors because they either what I call the strange, rare, and peculiar. They don't really have a diagnosis, right? It's just a bunch of constellations of bizarre symptoms. So they maybe get lumped into a syndrome, or I get these refractory cases where they might have an autoimmune disease, but they failed all conventional therapies. And they're, the conventional rheumatologist, like, I don't really have anything left for you except you stay on prednisone the rest of your life, but you're still obviously your quality of life is in the toilet, you're in breakthrough pain. And then people who just aren't well controlled on their medications, or they're looking to get off their medications, hence the root cause of medicine. And I was planning on actually going into conventional medicine. There's medical doctors in my family, and I never really heard of naturopathic medicine until college, when I dated a girl who's grew up with her pediatrician was a naturopathic doctor. But I was always kind of more into like herbs and natural things, not necessarily pharmaceuticals. I'm not anti-pharmaceutical. I prescribe them quite a bit. But what ended up kind of ultimately leading down the road was I saw how well it worked. And then I also talked to the doctors in my family, like, should I go to conventional medical school? What about this naturopathic option? And they all said literally the same thing. They were like, do you want to be a surgeon? I said, no. Like, do you want to be, an emergency room physician? And I always thought emergency medicine was like you see on TV, which it's not, which I learned during my rotations and residency. I actually enjoyed emergency medicine. They all said, you should go be a naturopathic doctor. You'll be able to help way more people than conventional medicine, because this 10-minute visits, the system's extremely broken, and really our training just allows us to have drugs and surgery. But there's so many things out there, which was interesting because these are all conventionally trained doctors, and they didn't necessarily super believe in holistic medicine. It's just that they may have exposure to it in one way or the other, which made them kind of change their mind and be a little more open to it. And then they came across some NDs in their clinical areas, and they were like, wow, NDs, qualified NDs, do really have good training and high qualified. So that's kind of what led me to it. And then I also am an subject matter expert advisor to the dietary supplement industry, a pharmaceutical group, and one medical group. So wear a lot of hats, divide my time up.
Thank you. And well, obviously, you touched upon a couple of things that are worthwhile to highlight and discuss. One is the telehealth approach, which I know since COVID that has taken a lot of strength. And it's great to know you can support individuals, in this case, like really health conscious adults, let's say, that are trying to see what else is out there, talking about the health system being broken and then how you can support your wellness overall in certain conditions, diseases, and how your approach will be valuable for them to find their health, their wellness.
Right. Yeah. So when I was in California, I was doing telehealth before telehealth was telehealth, when it was telemedicine, and there's a little bit of a difference between the two. And that was just because I would practice in the Bay, and it's highly congested. I practiced on this island called Alameda, and there's just a couple bridges in and out, and so I would get patients that might be, you know, 5 miles by the crow flies in Berkeley, but it would take them 45 minutes to get in. So they would ask, do I have to keep coming in for follow-up visits? And I said, well, I don't know, unless we were doing in physical medicine or injection therapies or IVs. I was like, I don't know. Let me see, my malpractice carrier would cover me, because when I practiced in Connecticut, you weren't covered anytime I left the office. My malpractice carrier only covered me in my physical office location. So no home visits, nothing like that. But I switched to a new carrier when I was in California. They said, yeah, as long as you see that person at one point in the therapeutic relationship in person, the rest can be the telehealth. And I was like, great. And then I was getting colleagues also in other states that might get tick-borne illness patients, and they're like, I don't do tick-borne, but I know this guy that does. And this was back in the days of Skype, if you remember Skype, which no longer exists. It was discontinued, I think, last year. So I was doing phone and Skype quite a bit. So then in 2018, when my wife and I moved back to the Puget Sound area, in the Seattle area, and we sold our practice to one of our associates, I was like, I should just go 100% telehealth. No more employees, no more contractors, just consolidate a lot of things. And the telehealth will allow me to access way more people than I could with a physical location, with just in, say, the San Francisco Bay Area. And the referrals from international mostly were because of two reasons. One, I was part of a nonprofit group called Clinical Education, where I was in a closed forum where I would help other doctors who were, say, junior clinicians, or they were new to functional medicine. So they would ask medical questions, and what labs to order, how to interpret labs. And then there was a few of us called thought leaders. We would guide them. So they might refer patients. And then I would be in these health summits, these medical summits that are pretty common, these like 4-day monster 80 specialists from around the world. And we all talk on maybe one or two topics, and then those would go out, and they're usually based out of the UK or Western Europe. And that's how I started getting a lot of international patients. I just had one yesterday that heard me talk on chronic fatigue syndrome on a summit that I did probably 6 years ago. And she's like, it really resonated with me what you said. I've had chronic fatigue for 20 years, and I've seen all these people, and et cetera. And that's where I get a lot of people from. They're like, I've tried everything, and I tend to kind of look at things maybe a little differently, or do things a little differently that they have not tried. And so then they kind of come and see me. But the telehealth, and then COVID, yeah, just made it easier. Everybody got used to not going into a doctor's office. They don't have to take as much time off work. I have patients see me at their lunch hour in their car. They're on their phone, because I use a HIPAA compliant asynchronous video software program, and just works just like Zoom, Google Meet, any of these. And they'll just be sitting in their car. They're like, this is great. I don't have to go to an office. I don't have to take half a day off. I don't have to wait in a waiting room. So most people love it. But it has its limitations, right? You can't do much acute care anymore. I can't, listen to people's lungs or look in their ears. No more physical medicine. But my practice hasn't really, in style, hasn't changed much with telehealth than it has with on-site. And anything, it's actually faster, because it's just right then and there. There's just me, and I get in and get out and take care of all the information, and then work them up. And being in practice 15 years, you can infer many things. So even if someone comes in with an acute illness, I can still do the appropriate care. And sometimes I'm like, this isn't appropriate. I need you to go to urgent care or even emergent care, which is what I would do with a physical location anyway. So it hasn't really hindered me a whole lot. It's just made me more accessible and reach more people.
Well, that's amazing. That's obviously a life-changing way to do things, especially from a patient perspective, saving time, saving hours, sometimes the hassle of going back and forth. And
Right.
at times is you get a quick in and out, but things will not be cured or treated per se.
Right.
So that is one of the things that it's worthwhile highlighting. And the other question that I have, probably for the audience knowledge, we have discussed like functional medicine, the approach. Can you just provide or dive into how functional medicine works, and how is it different from maybe just going to a regular physician and
Right.
getting advice on treating certain conditions or symptoms you have?
Right, right. A lot of it is root cause medicine. And outside of so the American medical system is very deft at treating emergent and urgent disease, right? We're the best in the world. We have the most advanced medical system in the world. But the way medicine is, right? If you have an acute illness, just biology 101, you either survive or you die. That's the way it works. Most people in the industrialized world, they suffer from chronic disease, which, and I thought the American medical model was broken, but then I started seeing people all over the world, and I realized their model and their system is just as broken as ours, just in a different way and for different reasons. So the way the American model is designed, which is an insurance-based model, does not compensate well for time. It compensates well for procedures. And if you're not doing procedures, it's not really an incentive for you from a financial standpoint to see people for a long time. So what do? You're forced to see people 25 to 30 patients a day. And all my conventional medical trained brethren, even my functional medicine brethren, are all medical doctors, right? I'm a naturopathic physician that I trained with and they're friends with. They all agree with me. There is no way that you can cure someone and really get to the cause of their things in 10 and 12 minutes, especially as you get older, right? Patients are more and more complicated. The diseases are more complicated. There's more comorbidities. It's no way. So it's mostly a system of palliative care, keeping you basically alive until your next visit. You check in, oh, how's this, how's that, medication management, on to the next. You're not getting to the why you have something. Outside of like you have bacterial pneumonia, the why is you have bacterial infection and you treat it with antibiotics, right? That's pretty straightforward. We're talking people with most, thyroid disease, autoimmune disease, irritable bowel disease, whatever, fibromyalgia, chronic pain, whatever it might be. Unfortunately, the primary care physician no longer really does what they were trained to do, right? The GP doesn't really manage everything anymore outside of like strains, sprains, coughs, colds, and annual wellness exams. It's like, oh, that's your thyroid, go to endo. That's your knee, go to ortho. Oh, that's your gut, go to gastro. And then they let that specialist take over versus just using maybe the specialist for their diagnostic prowess and then coming back. Like doctors don't visit you in the hospital anymore. We have hospitalists. The GP doesn't visit you anymore. You just wait till you get discharged. You go back to see your PCP. So it's become very fragmented and not enough time spent to really get to the underlying cause and also educate people on why you have things and why we're trying to make these changes. So functional medicine, naturopathic medicine, integrative medicine, they all pretty much mean the same thing, whatever kind of word you want to put on them. Naturopathic medicine, I'm biased because it's the oldest. And actually, what was born out of naturopathic medicine is functional and integrative medicine. But they all essentially have the same tenets where it's this whole person, whole body approach where you have a therapeutic order where it's the least invasive, least aggressive treatment interventions first, drugs and surgery as a last resort. But you still use those when needed. But it's really about getting treating the person as a whole. So when people see me, and they've got 14 problems, concerns on their problem list in their intake form. And then also, you want me to take care of that? You want me to take care of that too? And they are just elated. They're like, you can do that? I'm like, I will literally handle everything, you know, and we'll try. I'm always going for the cure whenever possible. So that makes them pretty happy. Like, I've got 14 specialists and I've got nowhere. I'm like, well, I'll be the person who basically takes the reins on all this and coordinates the specialists, and we'll use them for this or that, what we need. I'll do my own testing and my own interventions, and we'll go from there. And most people appreciate that, where they don't have to have 8 doctors anymore. They might be down to 3. Their primary, me, and maybe one specialist if they've got a neurological disorder or what have you. So it's really about treating that underlying. So why someone, say, has Graves' disease, which is autoimmune hyperthyroid, or why does someone have irritable bowel syndrome, right? The why. Conventional medicine is, let's put the Band-Aid and just symptomatic care, and maybe we'll put you on the FODMAPs diet and then hope for the best, which is not a solution. Where functional medicines, in naturopathic medicine, it's like, okay, so you have these symptoms, but what's driving those symptoms? Let's get to that, address those, and then lo and behold, IBS is cured. And I've done it, thousands of times in these conditions. So it's unfortunate that there's a split, but there's a reason why there's a rise in this type of medicine. People are sick and tired of being sick and tired, right? And they want to get better, not just have a bunch of pills thrown at them and say, come back in 3 months or sooner if it doesn't work.
Yes, and the other thing, the side effects of getting certain medications for just testing and see if that fixes the issue or the symptoms you're having. So
Right.
obviously, it's a great approach, the one you're taking, and it's a change. You're revolutionizing the approach, and that's amazing. So kudos to you. And before we run out of time, I did see some of your posts on LinkedIn. We're sharing below all your social handles. So if anyone wants to go look, follow Dr. Todd or email him and whatnot, below we're sharing all the information as a parenthesis. But well, talking about the gut and some of the things we have you have touched upon, what would be the main comments or highlights you want to mention from that gut standpoint? What role does it uh, play within our overall body wellness?
Yeah. You've done your homework. Those are great questions, right? I mean, naturopaths forever have been talking about the gut, and like when they teach you really early on in medical school, when in doubt, like you just don't know what to do. There's just too many things going on, right? If the waters are murky, they say treat the gut, treat the liver. And now I love when modern science proves age-old wisdom is that 70% of our immune system is in the gastrointestinal tract. I mean, the gut does way more than digest food. So when I have people that come in with irritable bowel disease, Crohn's or ulcerative colitis or irritable bowel syndrome, it doesn't matter what type, and there's always, I've never, ever seen a food not be a component, right? And there's a difference between a food allergy, a food sensitivity, and a food intolerance. Most people think it's the same. Many clinicians think it's the same, and it's not. A food allergy, a true food allergy, is you eat the shrimp and your face blows up, or you get a scratchy tongue, or you get hives, anaphylaxis. That's a true food allergy. A food sensitivity is more that gray area that may or may not be mediated by the immune system. And a food intolerance is not mediated by the immune system. And you do not get manifestations outside of the gastrointestinal tract. So really the gold standard is the allergy elimination diet. To know what a food intolerance, food sensitivity is. And I can't tell you how many gastroenterologists I've spoken to and patients I've had who say their GI specialist says food has nothing to do with your IBD. Food has nothing to do with your IBS. I'm like, that's just defies common sense. You're telling me that something you're putting into your gastrointestinal tract does not adversely or positively affect your gastrointestinal tract. So now you're seeing all this science with gut dysbiosis, right? An inordinate amount of pathogenic or commensal organisms that are outcompeting healthy flora, causing things to go awry, small intestinal bacterial overgrowth, small fungal overgrowth. So when those are all treated, and most people who have gut issues, gas, bloating, even if it's not flagrant, full-blown IBS or IBD, I'll do these stool cultures, I'll do the breath tests, and they're invariably always positive. Not necessarily both, one or the other, or many times both. So again, root cause, you treat that underlying infection, you remove the food sensitivities and intolerances, and then you rebuild their gastrointestinal tract so the leaky gut's resolved, and it's not, all these proteins aren't leaking into the blood, which shouldn't be leaking, right? Normally you shouldn't have gap junctions, you should have tight junctions in the GI tract. They're like, oh my gosh, my IBD is totally resolved, or I don't have IBS anymore. People might flare a little bit, but then you just learn what their flares, the triggers are, the flares, remove those, and you can get them off a lot of their meds, and they do really quite wonderfully. And people are like, this is crazy. I don't even have IBS anymore because the root cause was addressed.
Great. So thank you. Thanks for sharing with us. And one of the other things that I believe we discussed last time we had a chat is like this specific case on fungal infection that brought you to, or disease that brought you to where you are today. Is there anything you want to share with the audience as of how maybe someone that is listening to us might be feeling? It's probably thinking, is that the right approach, or how can
Right.
they know it's the thing they have to do next?
Right, that's a good question. So yeah, the story that kind of back to one of your first questions that got me into this, there was a few anteceding events, but one of them was when I was in college. My roommate and I adopted these cats, and which I didn't know until I spoke to a dermatologist. Kittens especially tend to carry tinea, which is ringworm, and tinea. That it depends where it is on your body. It could be tinea corpus, tinea unguium on your feet, and so I was getting treated by the dermatologist with these topicals for like 3 or 4 months, and it wasn't getting better, it wasn't getting worse. And so he says, well, really he's like, tinea is hard to treat because it lives between the layers. So the next step would be just putting you on a long-term antifungal, oral antifungal. But you have to get your liver enzymes monitored every month, and they're, 50% effective. I was like, well, I really don't want to be taking a medication. This when I was a junior in undergrad, and it's not maybe not even working. I kind of constantly get my blood drawn. And I was also in a mycology class for in my undergrad. We were talking about how the medications work and the liver toxicity and et cetera. So my girlfriend was like, "You go see my naturopath." I was like, "Oh, I'm not seeing some naturopath, right? This is quack." And she's like, "You should go see them." So I was like, "What do I have to lose?" So I went and saw the naturopathic doctor. It wasn't hers because she was booked up, but I saw her husband. And he comes in there and he's like, "Yep." He's like, so he breaks out this naturopathic medicine manual, and he said he gives me oral oil of oregano. And then again, it sounded so weird to me. He has me take garlic and slice them up really thin, put them over the lesions, and then cover them overnight with a Band-Aid. So I smell just like garlic, because you can self-inoculate. You just touch the tinea and you touch another spot, you get a new set of ringworm. It's very, very contagious. In Within a month, the all of the tinea was gone. And so I've never had it since. And this was what, 25 years ago. And I was like, I could not believe this. This is so weird. I was seeing conventional medicine. I was getting treated for 4 or 5, 6 months. Nothing was working. Wasn't getting better. Wasn't getting worse. See this guy. He tells me to take some oil of oregano and put some garlic on me. Oh, and he made me a lavender soap to wash my face with because they had like a soap concentrate there. I was like, all right, so maybe there is a little something to this system of medicine. So for your listeners out there, is that what I always tell my patients, who typically I'm their last stop on the road, right? They're just like, I've seen everybody. I've seen all the specialists. I've done inpatient. I am so sick. I'm on disability, or what have you. And I'll say, well, you'll get sick and tired of me before I run out of options, which is true. And that usually gives them a glimmer of hope, just to know that our armamentarium, right, is so much larger than just drugs and surgery, that it goes on forever. And yes, it is science-based. That's the big criticism. There's no evidence. What do you think all the medical schools in the United States were teaching before penicillin came around? They were all homeopathic and herbal medical curriculums and food, right? But now it's just drugs and surgery, right? And maybe they'll send you to a dietitian for some diet advice. But yeah, there's always hope and there's always options for cure, no matter what the health condition is.
Thank you. Thanks for sharing your story. I know sometimes we hear, and if it's part of something you've lived, and it's your background and how you got into where you are, helps connect and helps the audience see like you are human, and that it's true that things happen to anyone, and you've gone through that process, and it was probably painful, and at some point you were undecisive and doubtful of whether it will work or not. So thanks for sharing, and obviously you're a proof of that working and being possible of happening. And as you said, like there's some support in that, science behind it, and it's true. And part of the things that we're trying to achieve today, or the main objective, is to provide these insights, all the information, things that are available for anyone listening to us, that there's hope, there's options to treat yourself to achieve wellness. So if this is something that resonates with you, that will you think you will help anyone else, please feel free to share it and help spread the word. I know you're making a great job, Dr. Todd. So thank you. Thanks for being part of our session today, and happy to hear more and learn from you on how you're changing lives.
Yeah, thank you. I appreciate the invite.
Amazing. Thanks.
All right, take care. Bye.
You too.